Hello, my name is Michael Nyssen, Executive Director for the National Institute on Aging, a think tank focused on the public policy of aging in Canada, housed at the Ted Rogers School of Management at Ryerson University. I'd like to welcome all viewers here to the second day of the BC Care Providers Association virtual conference titled COVID-19, What Set BC Apart? If you were watching yesterday morning, the discussion focused more on some of the international experiences and the effects of COVID-19 on seniors' care from Canadian experts such as Dr. Samir Sinha, as well as from around the world, including Dr. David Grabowski from the United States and Professor Li Fei Lo from Australia. Today, however, in this panel discussion titled Canada and the COVID-19 Pandemic, What Went Right, What Went Wrong, and What's Next, we'll focus more on the experience nationally, including from provinces like BC, but also Ontario and the Atlantic provinces. Before introducing our panelists, however, I would like to first start by thanking Rexall Health Solutions, the sponsor for this session. So while Canada has been relatively successful compared to other jurisdictions in limiting the overall spread of COVID in the community, we have seen thousands of deaths related to COVID occurring in long-term care settings. The issue of COVID-19 has also consumed much of our attention at the National Institute on Aging, as we have been active in various areas of research such as tracking data and outbreaks and deaths related to COVID across all nursing and retirement homes in Canada. We have also produced expert guidance documents spearheaded by my colleague, Dr. Samir Sinha, to provide guidance to care homes, governments in reducing the spread of COVID-19. In Canada, we have seen that COVID-19 has had devastating impacts on seniors, including in particular on long-term care. Data compiled by the NIA shows that about 80% of all deaths related to COVID occurred in such settings, which is amongst the highest percentage among countries comparable to Canada. And although each province has been affected to some degree, various jurisdictions have been affected differently, which we will discuss later in this panel. And along with discussing what's transpired in other provinces with regard to COVID-19 and seniors' care, including the challenges, best practices, and lessons learned, this panel will discuss a variety of topics such as the role of the federal government and organizations such as the Canadian Association for Long-Term Care in dealing with COVID-19, how we could better prepare for a potential second or future waves, the role of the private sector, health human resource challenges facing the sector, and finally, the future of long-term care and seniors' care. With that, I would like to start off today's discussion by introducing each of our four distinguished panelists who are also experts in the areas of senior care. First, I'd like to introduce Jody Hall, who is the Executive Director of the New Brunswick Association of Nursing Homes. Jody also currently serves as the President of the Canadian Association of Long-Term Care and President of the New Brunswick Continuing Care Safety Association and co-chair of the Collaborative for Healthy Aging Care, which is working to create a shared conversation among stakeholders on the aging experience. Second, I'd like to introduce Dr. Janice Keefe, who is Professor and Chair of Family Studies and Gerontology and Director of the Nova Scotia Centre on Aging at Mount St. Vincent University, and an adjunct professor in medicine at Dalhousie. Along with being a scientific director for a national team to improve the quality of life for residents in long-term care in Canada, Dr. Keefe recently chaired the Ministerial Expert Panel on Long-Term Care for Nova Scotia. Third, I'd like to welcome Duncan, who is the Chief Executive Officer of the Ontario Long-Term Care Association, the largest association representing long-term care providers in Canada. Prior to her current role, Donna held the role of principal at Brunswick Strategic Consulting, where she led multiple strategic initiatives with senior leaders and boards in the public and not-for-profit sectors. From 2010 to 17, Donna also served as the president and CEO of the Hinks Delcroix Center, a large children's mental health treatment, research, and teaching center. Finally, I'd like to introduce Ali Devji, who is the Director of Stakeholder Relations and Business Development for the Good Samaritan Society. Ali is also president of the BC Care Providers Association Board of Directors and formerly was the Director of HR and Operations for Delta View Campus of Care, which was founded in 1976 by the Devji family. And with that, I'd like to give each of our panelists a few minutes to introduce themselves, starting perhaps with a few notes that we may have missed in our introduction, but then also maybe your reactions to COVID, where we are from your perspective as leaders in this field. So let's start with you, Jody.
Great. Well, thank you. And thank you to everyone for the invitation to be part of this event today. I do believe that the last 6 months have been certainly the most difficult that we've ever experienced in Canada in long-term care. And I do want to express my deepest sympathies to the families and friends of residents who have lost their lives as a result of COVID. Secondly, I would like to acknowledge the management and the frontline staff who have all given more than 100% to ensure that residents are getting the best care that they possibly can. There's no question that in spite of these incredible and difficult circumstances, that many things still have gone well. And we can see that there are many, many long-term care homes across the country that did not experience an outbreak. And we also point to those who have been on the front lines of this battle, because it's through their experiences that we have learned a tremendous amount that has actually better equipped all of long-term care across Canada to prepare for a potential second wave. So again, I thank you all for the opportunity to participate in this panel today and look forward to the discussion.
Thank you, Jody. Janice?
Hi, yeah, thanks so much. It's a real pleasure to be part of the panel. Certainly from my perspective as a researcher and researching the field, I think the one thing that I would say is that, you know, we all knew, all of us, whether you're a researcher or a manager, a staff or a family member, that long-term care has been underfunded in Canada for a very, very long time. And we really, you know, we knew there were cracks, but this really exposed just how deep those cracks are, and the way in which our society is really needs to take a second look at itself and value the older people in our society, value those who are vulnerable and frail and living in long-term care facilities. And I do want to also express my heartfelt thanks to all of the workers in care during the expert panel in long-term care in Nova Scotia. I heard so many stories from so many frontline workers who were just devastated because of the lack of value that they have in our society. And I think we really have to change our way of thinking about them. And I'd also like to point out the huge tragedy for family caregivers of people who live in long-term care. It's been really tough, and I think that's been really unfortunate that we weren't able to be more attentive to what some of their needs are. So I too look forward to the discussion. You've got some great people on here coming from very different perspectives, so I'm very pleased to be part of the panel. Thanks.
Thank you, Janice. Let's go to you, Donna.
Oh, thank you, Michael. And you know, I don't think any of us imagined what we were going to be going through over the past number of months. You know, this has been such a tragic experience for so many families, and but also the trauma that the sector has faced: systemic trauma, organizational trauma, individual trauma, and you know, my heart goes out to our front line and to our residents and our families, and for what they've been through. And I think it certainly has demonstrated that the cracks in the system, the stigma, and the psyche, and certainly the systemic issues facing our sector. As we watch this course across Europe, we could have been and should have been better prepared. And we owe it to our seniors to make sure that what we experienced in the spring never happens again. And we have a huge opportunity to make sure that the lives that were lost were not lost in vain, and that we do whatever it takes to amp up, to mobilize, to change this world, and to that, you know, to an earlier point, demonstrate the value we place on our seniors, the values we place on those who serve them, and looking forward to this discussion as we think about the future and contemplate what the next steps are, and how we can all come together to do that mobilization and change this and make sure that things get better.
Great. Thank you, Donna. Ali, we'll go to you, and then we'll jump into the discussion.
Sure, perfect, and thank you again. You know, I'm deeply appreciated both for the opportunity to be on this panel, but also to my fellow esteemed and respected colleagues, that as well as to you, Michael, for being able to participate in this very critical discussion on what has gone right and what has gone wrong and what do we do next. And I am proud that here in BC we've come together with a Team BC approach, but we did, as the folks have said earlier, we did lose a few folks, and no one wanted this to ever happen, and no one really expected this to come so quickly, and we weren't prepared. And it goes for all Canadians, whether we are working within the system or working, outside of the system. Sadly, long-term care hasn't been the priority that it should be, and always should be, and hopefully will be as a result of what we're going through now. My sympathies are to those that we have lost, and to their families, and also to the folks that have really been affected by things like visitor restrictions and the sort of the challenges that go along with COVID-19 and our response to it. And my hope is that we come out of this as a much stronger, better healthcare system, not just for British Columbia, but for Canada as a whole.
Thank you, Rally. And you've all given us already a little bit of an indication of your thoughtfulness on this subject, some of the challenges, and hopefully over the next 40 minutes or so, as we discuss, between ourselves, we'll be able to learn more from each other and go from there. So let's start the discussion. There's a lot of ground to cover. We want to try to get to as much as we can in this robust and complicated subject. I'll direct questions to each of you, but feel free to jump in as much as is possible given the virtual format. So with that, I'll start with you, Jody. As chair of the Canadian Association for Long-Term Care, CalTech, as it's sometimes called, or CalTech, can you talk further about the role that the organization has played during COVID-19, including what it's been advocating, and maybe even touch upon some of what you think the federal government should have to do, or does it have a role to play in long-term care in the future, particularly with COVID, but maybe even beyond COVID?
Great. Okay. Well, certainly CalTech has become more and more engaged in federal discussions as the COVID pandemic period has unfolded. This included opportunities to appear as a witness before two parliamentary committees as well as a Senate committee. And these initial presentations were really about trying to clarify the experience that long-term care has had as a result of this pandemic, and what we need going forward, and trying to correct the narrative that initially came out regarding the role of for-profit, nonprofit, and the overall management structure in the nursing homes. We were able to kind of really focus back on what the true drivers of these outbreaks had been in the homes, very focused on issues around infrastructure, around staffing shortages, lack of PPE, and it certainly was not about the management structure of the organization. And in fact, it did give us also an opportunity to highlight many of the systemic issues that we had been raising for several years. And if you look back over the last 4 budget submissions from CalTech to the federal government as an example, the very specific points that we were making was around infrastructure renewal and investment, our workforce challenges around recruitment and retention, as well as data systems, because we really need to be able to consistently tell our story from across the country, and better prepare for what we need to do for better quality and overall care quality in our homes. It's really tragic that it ultimately took a pandemic to get our issues to the forefront of the discussion with the federal government, but we certainly have taken every opportunity that we could over these last several months to make sure that the discussion is very vibrant, and very active in engaging with media as much as possible. So to the second part of your question, in considering the role of the federal government in the short term for long-term care as it relates to COVID, we really see their role as a scientific lead for the country. There are now guidelines for long-term care from the Public Health Agency of Canada, but these guidelines were only first published in April, which was long after many homes had already been experiencing an outbreak and trying to manage. So going forward, we certainly see the role of the federal government to play a much more comprehensive and on the edge of information for any new science that's emerging that would be of value to long-term care, for keeping that communication stream strong and vibrant with the sector. And very timely. And of course, the second role for the federal government would be that we see is around the financial support from homes. That has been a huge challenge for everyone. And we do look to the federal government to provide some assistance in a variety of ways through that. And of course, ensuring that PPE is available in Canada and can be affordably purchased for long-term care. So I'll stop there.
Great, thank you. Does anyone else have anything to add?
Yeah, it's Donna. I would agree in terms of what there is a role for the federal government. I do think that we've got to be thoughtful about what it is, and certainly there's been a debate around, do we open the Canada Health Act? I think people really don't fully understand that the Canada Health Act is about, I think it's about 14 pages, and that's in French and English. What is the problem we're trying to solve for? The federal government has a role, certainly in supply chain management. We know that early in the pandemic and continuing, the supply chain was strained, both in terms of personal protective equipment, especially for N95s, but also surgical masks, gowns, gloves, also with testing. And that role of the federal government, and certainly the debate in Ontario today in September, really is about can we get better testing, more rapid testing, and expedited results as well. And it is through Health Canada where that role comes into play. And certainly it's hampered us on the front lines, where long-term care homes have actually had to source their own personal protective equipment through China, and that's not our core mandate. And it really was a struggle because of that bottleneck, and also because of the lack of transparency. I don't believe, in hindsight, that there was as much transparency as there ought to have been around those pressures around personal protective equipment, especially as the need for personal protective equipment and what protective equipment we needed, or what test protocols we needed. Those were largely directed coming out of Health Canada. And so there was a disconnect between supplies for testing and for protection against what the guidance was. And it really disadvantaged the sector, and in fact, in many cases, sadly resulted in some of the losses, I would argue.
Yeah, I would just like to jump in too and say, Jody, with the work that I've done, I was on a working group with the Royal Society of Canada, and we released a report, Restoring Trust, what we need to do for getting our long-term care system back. And I just was reflecting as you were talking about the advocacy areas of CalTech with the federal government. They're almost identical to what came out of the Royal Society evidence report. We have to do things about infrastructure. There is a lot of emphasis on human resources, on appropriate remuneration value of those individuals, training, and data. A really important factor that you mentioned. I'll leave it there, but I think it's very nice to see both the sector and the academics actually agreeing on something.
Well, actually, let's carry on with you, Janice. We heard a little bit, obviously, from Jody and Donna, and now you on the sort of federal role, the national picture. But of course, we all know that there were very different effects across the country in each of the provinces. Arguably, Ontario and Quebec faced some of the biggest numbers and some of the biggest challenges. We'll hear more about it, but BC seems to have done slightly better. Can you talk to us a little bit about what happened in Nova Scotia, and in particular, where most of the deaths seem to have occurred in a single long-term care home? And why do you believe the outbreak was so large and limited to one facility?
Great question. Of course, it's good to have a little bit of context on this. This facility we're speaking about has about 500 beds. It's a traditional model, thereby having multiple residents that live in the same bedroom. And so I think before we go any further, I just want to reiterate that this particular facility actually had the highest level of performance given from Accreditation Canada. So they have accreditation with an exemplary standing. And so it's important that we realize this happened at a time, and I think Donna has already alluded to the challenges around PPE, some of the equipment, but it also happened when we didn't quite understand this virus. We didn't know that people could be asymptomatic and still be transferring it. Became a huge issue for that facility about how to isolate their residents when they didn't have enough space to be able to do so. So there was a lot of competing and sort of catastrophic sort of events that rose to make that happen. The other thing that I would also say, it was not only the only facility that had deaths. There were two other facilities, but much smaller numbers. And there were also a number of other facilities that had staff having COVID and or residents having COVID diagnosis, but did not die. So, it's not just the one facility, but you're absolutely right. It was traumatic. All I can say is knowing the people who work there, they're absolutely amazing. And they're as heartbroken as the rest of us about what happened.
Right, thank you. And actually, Dawn, I'm going to turn to you because I think, Ontario, I had already mentioned, had some of the highest numbers along with Quebec. We've seen very different effects of COVID across the provinces, I think, really belying the fact that there are no simple answers to what happened in Canada or elsewhere. We're obviously all still learning. Can you talk to us a little bit about your experience in Ontario working with your providers, some of the media attention, and just really, if you can cover a little bit of ground on especially between March and say June of what was happening in Ontario?
Yeah, thanks, Michael. So, not dissimilar to actually what happened in Europe and other parts of Canada. Part of our challenge was that at the beginning of COVID-19 and the pandemic, the focus was on hospitals, decanting in hospitals. There were no plans for long-term care, and in fact, it was suggested that there would be no room in the hospitals, anticipating a hospital surge for long-term care residents to be transferred should we go an outbreak. Certainly what went well in Canada and in Ontario is we did not have the same surge that we saw in Italy and Spain and the UK and now as we're seeing in the United States. We're very fortunate that people were disciplined. It did require, though, pretty much a total lockdown of the community and total lockdown and lockout in the homes. And we started the pandemic in what we called a perfect storm in Ontario: critical staffing shortages, highly deficient buildings with 3 and 4 bedrooms built to 1970 standards that were filled, a very frail resident population that wasn't, quite honestly, staffed or funded for the level of complexity and the care needs of our residents, and a profound lack of understanding in other parts of the healthcare system and in government, quite honestly, about what long-term care is and who our residents are and what our needs are. We've been pushed to the side. And then when it became clear, certainly in March, when things were really escalating and quite tragically in our long-term care homes, and certainly where we saw the greatest losses, those were in homes that were an outbreak early. So when we didn't know about asymptomatic spread, when we didn't know about the impact of community spread, we know that they were in homes with 3 and 4 bedrooms, where infection prevention and control initiatives that we would have used in a more traditional influenza outbreak or respiratory outbreak really were no match for this virus. This is a different beast. Certainly, another factor was critical staffing shortages, which were exacerbated once a home went in outbreak. We found certainly early on when the outbreak occurred, staff left. For a number of reasons, including fearing for the safety of their families, fearing for their own safety. They left because they had no childcare, because the schools and daycares had closed, and so we were crippled by that. But we certainly saw in some cases in those hard hit homes a reduction of staff to the point where they were working at only 20% of their staff complement, and those who were left were working 24/7 and doing whatever it took. We actually in Ontario needed to get an emergency order to essentially, it tells you the quality of our legislation, that essentially ceased the appliance of our legislation. So we had to get freedom to be able to redeploy staff. We had to get freedom to bring in new staff roles, unregulated roles, because of the staff shortage. And we needed to free up the time that we had for our nurses and PSWs to focus on care. We certainly also know that we did not have the partnerships and relationships with hospitals at all. And so even trying early days to ask for help, quite honestly, it was felt that long-term care homes were too dangerous to go into. There was a lot of blame on the operators and the owners, certainly people looking for a different villain. The villain in this is COVID-19, and we certainly saw that on a global context, not just in Ontario and Canada. But others, I think, took satisfaction by wanting to attack and blame rather than coming in to help. And we know what did work ultimately in long-term care in Ontario was April 15th, the government of Ontario introduced an action plan for long-term care that brought in the Army. Unfortunately and tragically, it came to that provided mechanisms for hospitals to go in safely and with more control over the home, so they could meet their insurance standards, because amazing how risk and indemnification became a big issue in this, in terms of preventing help coming into the homes. And we know that prioritization of personal protective equipment and testing for long-term care really mattered too. And we know that the infection prevention and control supports and assessments through the hospitals mattered. So it was devastating in a small number of homes. I would say that about 30 out of 626 homes were severely impacted, but the majority of homes did not have an outbreak, which you wouldn't know through the media. The majority of homes, so 51%, had absolutely no outbreaks, and closer to 80% had no resident outbreaks. Certainly we saw an escalation in staffing outbreaks as we continued with regular testing of our staff. And so the media really seized on this. There was a lot of fear, and I have to say our biggest fear from the beginning was fear, and we did see that play out tragically. And it demoralized the sector. So, as we prepare to go into a new wave, our homes feel set upon, beaten down, regardless of ownership. It is a sector issue. Our staffing shortage is more acute today than it was before, and we're fearful as we move forward around a second wave and not being able to have partnerships. It was a very adversarial time where long-term care was the villain. and didn't matter what your role in long-term care was, you were demonized, and so that I think really has impacted on an already fragile system.
Yeah, absolutely. And you had mentioned a couple of points that I think will take us to where do we go from here. But before we do, Ali, we'd like to hear a little bit about BC's experience. So I had mentioned at the top, of course, that Canada has the unfortunate distinction of having the most deaths relative to COVID in long-term care at 80%. BC, from the start, seemed to have been performing better. Its death rate in long-term proportionate with long-term care is about 60%. It's still a lot. In light of this, do you view BC as a success story? And if so, why? Or how do you contextualize BC compared to what we heard in Nova Scotia and Ontario? And what areas do you think are left for improvement for BC despite its relatively good standing across Canada?
Well, thank you for the question. And I think that, yeah, all things considered, when you look at the data and the performance of our sector here in BC, with all things considered, one can say we've been successful. Obviously, the fact that we've all suffered tremendous losses and challenges, I think that some can argue that we still have yet to achieve success, and I don't know whether one can ever achieve that in COVID-19. But that being said, what we found was we were hit pretty hard right at the beginning. I mean, one of our members was one of the first. Some say it was ground zero for COVID-19, and what happened was the system came together. The providers, the health authority, Vancouver Coastal Health Authority at the time was the health authority in which that member resided in, and what we saw was that COVID hit older sites. It didn't matter whose name was on the title, whose health authority was responsible. It hit older sites, as mentioned by my colleagues earlier, that were multi-bed wards, older infrastructure, older ventilation systems, smaller common space areas, narrow corridors, single access, things like that. And so those were hit pretty hard, and it sadly has actually affected more of our government and nonprofit sites than the private sites. So the narrative, though, across the country has been that it is the private sites that are responsible for a lot of what's happening, and that's far from being true. But that being said, people came together. And whether it was the people banging their pots at 7 p.m. every night and sending food and support to all of our care homes and standing outside or doing drive-bys to support the folks working within, the healthcare heroes all joined together. From the front line to the unsung heroes behind the scenes, the management that worked countless long hours without breaks and without any days off in order to do what we could. And so I've never had more respect for my colleagues than the last few months, seeing what many of them have gone through. And it's from their passion, their efforts, their abilities, and just by coming together. We've had this Team BC approach with the BC government, with the health authorities, and with the operators, and with the frontline staff. And we've been working together, whether it was the association working with outside of healthcare with the Vancouver Canucks, for example, to set up Operation Canuck that could bring in resources and support for our staff and the cleaning crews, or whether it was Safe Care BC's work on Operation Protect, which was essentially working with the general public and the business community to secure personal protective equipment, because our supply chains were interrupted, and we did everything we could as a community to step up. I would say that our infection control practices they were relatively good. There was obviously some revisions that were happening on the fly, as one of my respected colleagues says, where we were flying the plane and trying to fix it at the same time, and so there were a lot of lessons learned. Obviously, nobody really knew about this virus, as much as we had hoped to know, and so some of our practices before that actually really do work may have been called into question and then later validated. So, and there were new practices that were added, and so I think that has been helpful. And I think that in BC we have newer infrastructure. Our BC government for the last 2 decades or so has been investing, not to the level that we want, but they have been investing in renewing our bed stock and creating more spaces for seniors and for their families to receive care safely, and that has made the difference. And what we've seen is that there's more work that needs to be done. Obviously, some of the challenges we have are related to the necessary single site order. I mean, it was put into place early on in the pandemic in order to ensure that staff didn't travel between site to site and potentially spread the infection, and but that has resulted in really highlighting the strain of the system in terms of the lack of health human resources, and and there still needs a lot of work to be done to continue to renew our infrastructure. As Jody said, it's something we're working with the federal folks, but we're also working with the folks here in BC, and I'm very pleased at what the indications are from our provincial government, that they are willing to work with us and they want to work with us in order to solve this problem and really strengthen the seniors care sector.
Right. And actually, you kind of lead us into the next segment where we're going to start talking a little bit about some of the sub-issues, the particulars that are affecting us. But before we pivot to that, I'll start with you, Jody, but I'm also curious to hear anyone's thoughts, Donna's included, from Ontario. But now that we're sort of looking at what a second wave might look like, I think some of us might say that it's already coming upon us. It just hasn't burst out into the media yet. But as we look into the fall, winter, and the immediate horizon, what are some of the lessons learned that we could apply in the short term, whether it's for the sector, governments, or other stakeholders to prepare for what's imminently coming, assuming it does come? We'll start with you, Jody.
Okay, thank you. Well, I think the critical things that we've discovered is keeping open communication and collaboration right at the forefront. Caltech had hosted biweekly calls for several weeks over the last 6 months, and it was just an opportunity for all of us on the, supporting those on the front lines to share best practices, compare notes on policies and procedures, and really just trying to learn, all of us trying to learn as quickly as possible to help support the homes in the best way that we could. And, I do also believe very much in the power of grassroots advocacy and kind of equipping the homes and encouraging them to reach out and to give us the information, but also to government and other stakeholders about what they were experiencing and what they needed to be able to address them. And that was very helpful in creating some really important conversations with critical decision makers. I think that, when we look at the homes, it's just so important to remember that, this infrastructure piece in particular isn't just a nice to have, or, that would be great, but not necessary. These homes were really designed for, many of them were designed for a different generation and a different time, and we absolutely see the effect of that. And so with the experiences that we've had over the last 6 months, it really has helped to kind of enhance and enrich those important discussions. when we talk about kind of collaborating amongst the sector in itself, certainly the operational things, just sharing policies, procedures, techniques, are so important. But I think, I think Donna had made reference to this earlier, that we need to take time to care for ourselves and for one another. This season has been emotional. It's been draining. People are physically and mentally, certainly from what I'm seeing, struggling a bit to really keep that positive outlook and ready to take what's going to, or just deal with whatever is going to come. So, I guess I would offer that is also a critical component, is just considering our mental health as we continue to work our way through what is a really difficult time. So ultimately, with all of this, there is a shared responsibility that often we don't always necessarily see for long-term care, especially between the federal and the provincial governments. But I think the time has come where that is clear that needs to change. And of course, us all working together as a sector to support one another in the best way that we can is critical.
Donna, Janice, I'd be curious on your thoughts. What are a couple of the sort of immediate things that we might be able to do in the short term to shore up the sector, or advice for governments and stakeholders as we look at the second wave coming?
So, OLTCA on the Ontario side, we actually launched a Wave 2 action plan in May, and we've done a lot of deep policy work and planning work around how to operationalize the plan, and we built it in partnership with the long-term care clinicians. Certainly through the assessments of the Army and the hospitals, we identified a number of gaps, and so we were urging the Government of Ontario to address those gaps throughout the summer months. So that included what are the mechanisms to ensure that we have more physician presence on site, to provide some medical management in the homes on a more consistent basis, especially given the clinical needs of the residents in the homes. Certainly continuing with the personal protective equipment prioritization for long-term care and the testing for long-term care. And then the other piece was how do we embed and grow the capacity and have dedicated capacity for infection prevention and control in the homes. Unfortunately, none of those things happened over the summer months, and so we are already, certainly we're seeing outbreaks in Ontario in long-term care homes and more losses and more staff being infected. The staffing piece for us is critical right now, and as Jody said, if we're going to we got through wave 1 because people did come and help, and we got a lot of help. And if we're going to be up against this again, and when we know that our frail seniors are highly vulnerable to this virus, we're going to need more help. And unfortunately, what we're starting to see is very similar to the planning for January is hospitals are full. They're wide open. They are certainly trying to deal with the backlog, and elective surgeries or emergency departments are at capacity, and their alternate level of care beds are at capacity. We've taken 4,500 beds out of the Ontario system by restricting admissions into 3 and 4 bedrooms and limiting those to 2 people. We certainly need to have a plan around if there's no hospital space, and we need more space, both to create capacity in the hospitals, but also perhaps to move residents out of long-term care into a different care environment. Then we need to be working at and looking at alternate spaces in various communities across the province. And certainly OLTCA, we did the data mapping and geo-mapping for the province about where those bed shortages were going to come into play. And so we need to work in partnership and together with the hospitals to have a plan to really document what does escalation look like when a home goes into long-term care. And unfortunately, what we're seeing in Ottawa is, again, that delay where we need help and we're asking for help, and then help doesn't come until things are more critical. And part of that, what we're seeing is also, we believe, informed by the legal actions. So there are Most homes who went in outbreak have been served with class action lawsuits, and the government's defense, quite honestly, was tabled, and we just recently got a copy of it, was to say that the government of Ontario has no responsibility or an accountability to ensure the health and safety and well-being of residents in long-term care. So we're certainly, as we prepare for this wave, seeing the government issue readiness assessments for the pandemic that identify the gaps that we know have been there historically, and advising that those people who manage the homes, that they're responsible for addressing the shortfalls and the deficiencies. So we've got to find a way to get through this. We need to mobilize to recruit new staff. Certainly, we've seen Quebec and BC out in front of the staffing shortage issue, where the government is partnering with the sector to address the critical shortages. That's not happening here, or certainly hasn't happened yet. And so we are quite honestly very fearful. Because we know just how fragile our sector is right now. We know that our residents are more fragile and our staff are more fragile. We need reinforcements. We're going to have to be creative. We're going to have to be nimble. We know government can move quickly when it needs to. It has to now. But we've got drive for solutions. What are the band-aids? Because this will be about band-aids, especially in the near future. But let's do that and put our heads together and find a way through. And that includes looking at what's happening in other jurisdictions in Canada, as well as other jurisdictions such as the UK, Europe, and parts of the US. We're not seeing that just yet, but I think, Michael, the work that your think tank has done provides a roadmap, and there are others who do know what the solutions are as well. And I think we've just got to act now, force the political will, and not accept no, and not accept the status quo. That's it. We have to become a little more militant about this, and we need to work together. And it can't be that long-term care homes are the enemy. This is about people. There are people in the beds. There are people beside the beds caring for those people, and there are people who are their friends and family and loved ones. So we need to. We need to act, and we need to mobilize.
Thank you. Janice, before you jump in, if I could ask you, absolutely touch on some of the, as Donna says, the Band-Aid solutions, things we could do in the short term. But I know also that you've written a lot on the workforce issues for the future. So can you also talk a little bit about what you see as some of the potential challenges and solutions to the workforce issue, even beyond COVID?
Yeah, sure, absolutely. I think there's, from our experience with the expert panel far before the COVID crisis, we knew there's issues around recruitment, especially around retention of workers. We're training frontline workers and they're leaving. We don't even know where they go. There's no registration, there's no regulation. And so that has to change for those personal care workers, the care aides or continuing care assistants, whatever you want to call them. And I think we need to enhance our allied health workers as well in terms of getting people up, getting them mobile. I think part of the challenge is understaffing is affecting people's mobility and then increasing demand for staff that already are there. One of the things I wanted to pull out, because I think it's really been touched on with the and in the Royal Society report, I encourage everyone to have a look at that. We spent a lot of time on the health human resources, and as Donna is saying, we need some things happening now. Some of the governments have made these one home solutions, and that should be evaluated in terms of what does it mean. But I think the other part is we have relied on casual staff. We've had challenges around workman's compensation and people out on workman's comp. We need to be able to offer some of these individuals to value the work, to offer them full-time hours if that's what they want, with appropriate pay and appropriate benefits. And we're not able to do that right now. And we need to be able to think about how to best do that. In our Royal Society report, we really called on the role of the federal government. And just going back to what Jody had introduced, what we need for the second wave, at one point in time, the federal government and the provinces have to stop squabbling, because this is about real people. It's about older people, frail people, vulnerable people, and their families. And we need funding from the federal government to be targeted to long-term care. And it needs to be accountable. It needs to be transparent. We need to know what it's used for, but they desperately need some influx of cash to be able to make this happen. And we also need to think about educational standards, training for the personal care workers so that they have the capability and competencies to work with the residents, many of whom have a dementia. And finally, in the interim, I think it's been mentioned, but I just want to reiterate it, that the strain and stress on all of us during the pandemic, but multiply that by 50 if you're talking about people working in long-term care. The fear that they've had, the dedication that they've had, it takes a toll on who they are and their own mental and physical health. So in the short term, we need to really pay attention to that and provide some really resources, because many of these people we know are going to experience post-traumatic stress disorder. They've seen way too much, and they've been trying to stem a virus which we knew very little about, and can, create that sense of helplessness that we really do need to address and value who they are and the work that they've done. So I'll stop there. I'll go on too much sometimes.
No, thank you very much. And it's a great discussion, and I'm sure we could probably spend most of the afternoon talking. I'm just aware of the time here and that we're coming close to the end. I'm going to give a final opportunity, and I'll pose a question to each of our panelists to touch on the future. But in closing, as we get close to this, I'd like to thank again our panelists for today's important panel discussion, looking further at the experiences across Canada with respect to COVID-19 and seniors care. And I'd like to thank again our sponsor for this event, Rexall Health Solutions. On Friday of this week, we will also continue with much discussion during the panel, looking more specifically at British Columbia experience with experts from across the province, and which will be moderated by Mike Klassen from the BC Care Providers Association. But as I indicated, before finishing with final remarks, I'd also like to remind those watching that there's a short break at 11:30 a.m. with Laura Tamblin-Watts, President and CEO of CanAge. She'll be providing a webinar on the issue of family visits, another hot topic issue that's come up over the summer, certainly, and which you are probably familiar with, has been one of the most challenging issues the seniors care sector has faced throughout COVID-19 pandemic. But before we close, I want to make sure that everyone has enough time. We've talked a little bit about the challenges we've experienced and some of the problems, but looking ahead, post-pandemic, 5 years from now, where do you think we should be? Where do you think we will be? And what do you think it'll take to get us there? I know it's a mouthful. We'll spend a few minutes on each of you. Jody, let's start with you.
Okay. Well, I guess I'll start by just reiterating, those three key areas of focus that the Canadian Association for Long-Term Care has taken, because for us in this sector, I do believe they are critical to our future. So that's the conversation we've been having about the need for infrastructure renewal and investment support in that area, in particular from the federal government. Recruitment and retention. We know there are a number of things that can be immediately done to better help us with immigration, but certainly we know that domestically we really need a pan-Canadian health human resources strategy, and that's something that I think largely absolutely needs to be tackled over the next 5 years. And of course, the data component. One of the first things that we're always asked when we're advocating and having these important discussions is, what's your evidence? So it is absolutely critical that we have a way to collectively tell our story, to capture those important metrics, and to be able to relay those forward. And of course, also that we can use to better improve our residents' quality of life and quality of care. I'm also very aware that there's a lot of discussion that's happening right now about the federal government introducing national long-term care standards. And certainly our call to action to both levels of government, federal and provincial, is that there is immediate action that needs to be taken, but in the long term, this sector needs to be part of the table. We need to have a voice there. We need to work collaboratively. We know what the issues are. We know what needs to be addressed to make the sector sustainable for the long term, and we certainly call on both levels of government to partner with us in that regard.
Thank you. Janice.
I'll just, I agree with everything that Jody has said. The only thing I would like to really emphasize as well, hopefully in 5 years, will have come to a point where the residents' quality of life will be foremost, that we won't have to keep them in their room and not have visitation and not be able to do what they what gives them some joy in their life. And that may involve improving quality of work life of the staff. Of course, we need good quality of care. I'm not saying that, but we also need a good quality end of life. And I think putting more of our emphasis on those facilities as the home of that resident is going to be critically important as we move forward. Thank you.
Thank you. Donna, before I turn to you, perhaps you could also contextualize the 5-year question within the context of Ontario's commission into long-term care. Do you think the government's commission is going to get us there? And if not, how do you see us proceeding over the next 5 years?
I think the commission is about looking backward and a moment in time. And I would argue that the challenges we face in our sector in Ontario, and it's fragile, is we always made changes to the sector for yesterday, not for where we're going. And it will be interesting to see what the work of the commission unveils. We hope that there will be recommendations that will support the roadmap. But in my mind, a big anchor for changing long-term care for the future is I think, to Janice's point, really think about who our residents are, what their needs are at the end of their lives. And certainly we're seeing in Ontario, in terms of our data, that this is largely becoming more end-of-life, longer-term care. And so how do we make it okay? And how do we make sure that long-term care is better aligned and integrated with other parts of the healthcare system without making this a sterile medical model? We've got to find that balance. But we also are going to get there by changing the way we talk about long-term care, validating the people who work in it, valuing it. And recognizing that we're partners in this, and that the only way we're going to fix it is together. But the change in tone and approach and how we regulate and inspect, how do we focus on quality standards and the outcomes and experiences of our residents and families and staff. We certainly in Ontario manage to a very prescriptive compliance framework, not to the people. And we've got to make it about people. And, ideally, I think we will be on a path. We won't be there, but we will be on a path to a system where it's safe and okay, and families don't feel guilt and grief when they have a loved one who can no longer be cared for at a home and need additional supports. We need to know that they're going to feel comfortable with that reality or that fact or that choice. And we need to make sure that our staff feel valued and that they know that what they do matters, and that they're cared for in environments that are respectful, that are bright and sunny and airy, and are the places that somebody would like to live, and a place where someone would like to work, and that are places that are safe. And so how do we not lock in to fix what just happened by complying and doing a knee jerk to say this is what it needs to look like today? How do we open it up for innovation and creativity through innovative partnerships and collaboration? In my mind, I'd love to see us get there. But let's celebrate incrementalism and build on the new partnerships and relationships that we have including with our families and our residents and our colleagues across the country, as well as our colleagues around the world. I think we're creating a movement through this, and I do believe that we're going to have louder voices as we move through the fall and the next season and the next wave, and that those united voices will be agents of change.
Thank you. Nally, we'll go to you. BC, of course, has said at the moment that it's likely not to hold a review or government commission. So from your point of view, where do we need to go in 5 years, and how will the BC Care Providers Association play a role?
Well, thank you for that. I mean, and further to what my colleagues have said, I mean, we actually did suggest to the provincial government that there should be a independent review done. However, we did work with the provincial government to put forth an interim sort of review in that in the form of our COVID-19 second wave task force and recommendations. And we did come up with 17 recommendations. Those were grouped in themes based on pandemic coordination, reducing the transmission of infections, supports for staff, but also for operators, because if you can't keep the operators' lights on, then we're all going to suffer. And social supports, in order to maintain the relationships or improve the relationships between the residents and their families and one another, and reduce social isolation, which I think Jody and Donna and Janice would agree has been one of the challenges even before COVID. We've talked about single site orders, that those need to continue, but also wage leveling needs to be in place permanently. But the money needs to flow. It needs to flow, immediately, and advances need to be made if there's an outbreak, right away, because there will always be a reconciliation and accountability that's always been there. And so, we need to work on things, whether it's exploring whether or not we need to relocate COVID-19 residents or those with other infectious illnesses to specialized units within acute care so that we can prevent the spread to others. But I think, what I'm hearing from everyone is that, and I truly believe this, is we need to work together, but we need all levels of government, all stakeholders to work with the industry to train the staff and to make long-term care a place where everyone wants to be in, and a place where everyone wants to work in. And that means transforming healthcare. It means changing the culture of our acute care system and our healthcare system as it is, so that long-term care is prioritized, and the folks that receive our services receive better quality services each and every day. And I think that's what's so important. And 5 years from now, I think if we continue this same passion and we're able to bring all the best and brightest together, whether you're in government, whether you're in academia, or whether you're in industry, or like me, grew up in the care home, we need all those types of individuals to come together and really figure out solutions going forward, because this is one system or one place that we're all going to need, directly or indirectly, and it's up to us to raise the bar. And there's stuff obviously that can be done federally, whether it's immigration reform, whether it's helping mobilize the unemployed or the underemployed into healthcare jobs, recession-proof jobs, or whether it is, including long-term care in the national housing strategy. There's so many things that can be done in the short term, and obviously there's things that we need to do for the long term, but it really needs all of us to come together.
Thank you very much, Ali. That brings us to the end of this panel. I wanted to take a moment to thank the BC Care providers for hosting this important discussion. I think we all recognize we could have used a lot of time to talk about this, and I think we'll look forward to future opportunities to connect. Thank you to our panelists, Jody, Dr. Janice Keefe, Donna Duncan, and Ali Delgi. Thank you for hosting me as well, and have a good day.
Thanks so much.